All right, here we go. Um, Catherine, I really appreciate you taking a little bit of time to speak with us today. Um, I've known you for a little over a year now. We first met in December of 2021. Tell me a little bit about your headache story up to that point. What was going on with you and what was going on with your headache specifically?
Okay. I had had a whiplash injury, which then developed into occipital neuralgia. I was on massive amounts of opioids to try to be able to function. Um, I was in so much pain, I could not do the things that I like to do, which was paint shells, read, do puzzles. I couldn't do things with my friends. It was basically put ice on my head and take drugs, and that was it.
Yeah. And by the time we met, you'd done all sorts of things over the years. Can you tell us, aside from all the medications and specifically all the narcotics, what
Yeah,
other things had you tried that didn't seem to work?
injections.
Hmm.
The occipital nerve injections that I had tried with the steroids and the local anesthetic only worked for 2 or 3 days.
Hmm.
And my neurologist said that was normal with occipital neuralgia. So I was getting pretty desperate, and I joined a support group on Facebook and heard about you. And that's when I contacted you, and I had some hope.
Yeah. And I think your story really illustrates the fact that, like so many people and patients, the nerve blocks, even with steroid, they're really good management strategies, or sorry, diagnostic strategies, not management strategies. They really
Mm-hmm.
don't work for any
Mm-hmm.
meaningful period of time. So sure, a few days of relief is certainly wonderful, but it's really sort of a band-aid over the main issue. And so at the end of the day, it'll be a year, 2 days from now, but we diagnosed based upon those similar kinds of nerve blocks used as a diagnostic modality that you
Mm-hmm.
had three nerves in the back of your head that were causing the problem. We operated on those. You're essentially a year post-op. Tell us what's going on now.
Now it's wonderful. Right after the surgery, it was very painful.
Hmm.
The nerves were upset.
Yeah. Yeah.
And fortunately, you were able to tell me that that's normal and they would settle down.
Hmm.
So, and that's what happened. This I started having less and less pain, and eventually I didn't have anything.
Hmm.
And
Because you're,
it's pretty, yeah, it's been great.
yeah, so your pain was 24/7. And as we were speaking just before we started recording this, you said it's been a very long time since you've even had any of that similar pain.
Yes.
So
Yeah, and
that's
I'm
great.
talking severe pain,
Yeah, yeah.
you know,
For
crying
sure.
in my doctor's office pain.
Yeah, yeah. So I guess this is really the upshot. Given that lack of pain now, tell us what kind of difference that's made in your life. What are things you're able to do now that you weren't before? How has it changed things for you?
It's it's like a miracle. Um, I can go to lunch with my friends. Um, I can have conversations with my husband. We can go out and do stuff together. And, there were just so many areas of my life. I used to paint shells. I live in Florida,
Mm-hmm.
and I would paint shells. And when the neuralgia hit, I just couldn't do it. I would go meet my friends and I would try to do it and I would have to leave.
Yeah.
So now I can do the things I want to do and I don't have to say, sorry guys, I gotta go. I'm in pain.
Yeah. So, listen, you've been a tremendous success, and I know you're super busy now with a much fuller life, which is so wonderful to hear. So, I really appreciate you
Mhm.
telling us a little bit about your story. And yeah, listen, I wish you the best of luck moving forward. As you know, we're always available if anything comes up. I don't expect it to, but if anything should change, or God forbid, there's another accident of some sort, you know where to find us.
Yes.
And again, really want to thank you again for telling everybody about your particular journey. So have a great day.
Yeah. Thank you very much.
You got it.